welcome back for, I guess, the second time because...
The second time coming back for the second time.
Yes.
Is that the fourth time or the third time?
Dude, I don't know, man.
That's a lot of times.
Camera overheated, decided to take a nap.
We're going to get better at this eventually.
We will. No, it'll be good.
We might get worse and then just quit. No, this is too much fun.
Yes. So we kind of discussed it on the first episode that we recorded.
Yep. What was that we discussed?
A little bit of gangrene.
My favorite.
So today's episode being, is it rotten? And the answer is always yes.
It is always rotten. It's either shit or rotten.
Yes. So if you could, for the people that don't know, gangrene.
I actually pulled up the other thing too.
Okay.
So gangrene.
Yep. That's a very Bible Belt way to say it.
Yeah. It is dead tissue caused by an infection or lack of blood flow. The death of tissue often occurs in the extremities or skin from loss of blood supply. So it's an ischemic injury, and then the tissue just rots away because bacteria are hungry little boys.
Little hungry guys.
Little hungry guys.
Yeah, man. So it's disgusting. You'll smell it forever, and you'll never forget that smell.
Yeah.
It will live in your nose, and it goes right here, and it never goes away. In your clothes,
it lingers.
Stuck. Yes.
It's like a really good fart.
Can you hand me my drink? I don't know why I said
yeah, of course.
Thanks, man.
So we had an interesting case come in. It's the first time I've ever seen it. This guy came in, he had like a pimple on his groin, and the doctor was like, "Oh shit, you need to go to surgery immediately." And they brought down the surgeon. So I asked him what was going on. He's like, "It's and I found it. It's Fournier's gangrene or Fournier's disease." And it's where you get these little abscesses on your groin, like on your taint or your groin or around your genitals. And it's a form of necrotizing fasciitis. And they skin your entire groin and taint and your genitals and like exposed balls.
Correct.
Yeah. Not fun.
Yes.
We are going to give so many people anxiety. They're going to get just a little spot.
Yeah. You're like, I have it.
They're going to go in, they're going to be like, I watched this shitty podcast with these two shitty medics and they said I have Fournier's disease.
You do.
Yeah.
You should look it up. You definitely have it.
They do.
Yeah.
They do. Look up gangrene.
Yeah.
Google images. Gangrene.
Have to.
Yeah.
Go on Reddit. You'll find it.
Don't go on Reddit.
Yeah. So I have a couple stories.
Do you?
Yeah. First one, it's a hospital. EMS brought in this guy. It was a welfare check. They bring him in. He was all wrapped up in a whale tarp, the mega movers. Plop him in the bed and start stripping him down. And he's completely altered. Missed like 4 treatments of dialysis. And I'm pretty sure that's what actually set off the welfare check. It was the dialysis people called the family.
Yeah.
Family decided to.
People who missed just a couple dialysis are dead.
Yeah, they're dead at that point. So they ended up bringing him in. The guy's totally altered. And so I'm outside of the room, and the nurse, who I highly respect, comes out and has a look on their face, and he's like, I need a doctor. So the doctor goes in, and I'm like, oh, I'm following, because this is going to be good. And so they have this guy stripped, and he's obviously soiled himself. Like, he's been sitting in a chair for, 8 days,
ever,
right? Whatever,
forever,
just days, whatever it is.
Yeah.
I don't know. So they're like, we're going to clean him, but your Fournier's, maybe I don't know the actual disease process, but they're like, looks abscessy, taint area.
Oh, he might have Fournier's.
Well, he did. He had something. So Doc's like, yeah, that looks pretty bad, but we have to clean him. So they just went in and they grabbed some towels, right?
Yeah.
And went, slapped it on, and did like a couple good swipes, and then went like this, heavy swipe in.
Yeah. This is like gutting a pumpkin.
Yes. Dude went like this, and then everything went whoo, and came out. Guts It was intestines. Everything just went.
Oh, so he's dead.
That's what finished it off. Because
Yeah.
when that happened, they wiped to clean him, and intestines, and then massive hemorrhage.
See, that's why you shouldn't wipe too hard.
Don't wipe too hard. leave a little brown, just in case.
Yeah, you can always take a shower later.
Yeah, you can hose it off.
Yeah,
waffle stomp it.
correct. Yeah,
But yeah, so that was my first encounter with gangrene, and that was gnarly. It was insane, and just watching someone who was going to die. They were critically ill with everything else, DKA and everything, and they just swiped them and ended it just like that. It's like have you seen like the Nickelodeon slimes, the old school? It was just like that.
I thought you were gonna say like the addicts where you pull the ladder down.
Yeah, but no, it was just like the old school Nickelodeon slime. They just wiped and it went wonk.
Yeah,
and everything came right out. It was gnarly.
That's unfortunate.
And that was the first time the doc, and he was pretty stone cold doctor. First time he threw up.
Your doc threw up?
The doc threw up.
Wow.
He came out, dude, wretched immediately. Turns the corner and
I've only ever one
Dude,
time I almost threw up, and that's because a lady spit on me.
In your mouth and you didn't pay for it?
Yeah, correct. Now I don't have to pay for it. I found a significant other, and yeah.
Good. Oh, I'm sorry.
We've all worked out in the boonies at some point in time. We got called out to a chest pain call. There's a guy doing construction on a new build, and they were working on the basement. It's all concrete, and it was all like that 2-inch gravel all the way down this steep driveway into the basement. Basement hadn't been poured yet.
Yep.
And I don't know, he's like mid-40s.
Yep.
He's got 2 workers with him, and he's like, yeah, my chest hurts. We're like, okay, well, we can't really get the stretcher down here safely. Can you walk? And he's like, nope, can't walk at all.
Cool.
And he's standing. So I'm like, what is this? Fine, whatever.
Well, that's where you die then. I don't know what to tell you.
It's where you get the volleys to bring the stretcher down, and then they can push this guy up the hill.
Nope.
So we get him into the back of the ambulance, do all the, chest pain workup. I'm like, man, so what's going on? And he said, can you look at my feet? I said, absolutely not. No.
Yes.
So I do my general chest pain workup. It's unremarkable on the 12 lead, nitro is doesn't give any pain relief.
Yep.
I'm like, whatever. This is take you to the hospital. They can deal with it.
Yeah.
So we take him up to the hospital. I call it in his chest pain. And the first thing he says to the nurse, can you take a look at my feet? And the nurse is like, what? And he said, yeah, my left foot has been bothering me.
Not your chest.
And she says, okay, well, is there anything going on with your feet? Is this new? And he said, I haven't taken my shoes off in 3 months. And this guy's a diabetic. So she's like, I got this. And I was like, I'm staying for this. I'm going to stand at the door in case it smells real bad.
You're like, no, you don't, but I'm here.
So she takes his shoes off, and immediately the foot looks weird. And she pulls the sock off. And when she pulls the sock off, his toes come off in it. 3 of his toes and part of his foot.
Hell yeah.
He had a diabetic ulcer.
Just rip the whole foot right off.
Yeah, and his foot rotted in his shoe, and he didn't take his shoe off for months because it was probably so painful. And finally, he was like, I can't stand on this foot for some strange reason.
Dude. Yeah. There was a call at another service. The person was in a really shitty inner city nursing home.
Oh,
really shitty. And just sick. They're like, I'm pretty sure it was a call for an abnormal labs. And you're like, oh, okay. And they had gotten there. It wasn't my call. But in detail, the foot was mummified.
Yeah.
It was dead and hard as rock.
Oh,
yeah.
Foot jerky.
Dude, jerky.
Slice you off a piece?
Dude, yeah. They were like, well, they're a DNR. Like,
yeah.
But they're not dead. They're like, I guess we're going to take her to surgery. Pretty sure they amputated, but the nursing home was like, oh, we just thought that's what her foot looked like. And it's just this decrepit, like if you microwaved turkey jerky for like 3 months, that's what it looked like.
Yeah.
Just mummified.
That's impressive.
It's insane.
Yeah.
It's insanely negligent.
Yeah. I think we have an entire episode of talking about nursing homes. So,
Yeah.
we can save
That'll
that
be
for
a fun
later.
one. Yeah.
That one's going to be hot. There was a lovely long-term care facility that we used to attend, and there was a regular there. He was young, like mid-20s.
Mm-hmm.
And he was actually running from the cops after robbing a liquor store,
Mm-hmm.
and he got shot in the spine. And he was a partial quad, so he only had like this movement in his arms, paralyzed from the waist down, and he was such a dick that he wouldn't let the nurses turn him, and he ended up with a big abscess on his ass, and it got gangrenous and nasty, and it was just pouring purulent fluid, just the nastiest ones. So we go to pick him up, and the first thing he's like, fuck you guys, fuck this nursing home.
Okay, cool.
These
Wow.
motherfuckers don't take care of me. I got this big this big spot on my ass, and he leans over, and he's paralyzed, so he can only lean over.
Show me how he leans over.
He leans over like this, and then he takes his 2 fingers with his nails that are like a half an inch long because he won't let them clip his nails, and he starts sticking his finger in this big open purulent abscess, and he puts his fingers up, and he has pus between his fingers like he's trying to blow a bubble, and he's like, I got all this fucking shit coming out of my ass, screaming at us. I was like, dude, just don't touch anything.
His second asshole.
Yeah, just don't touch anything.
Stop. Yeah.
Burritoed him.
Yep.
And then just took him to the hospital.
But you can close your eyes and remember that smell.
Yeah, I can remember his stupid face too. He was such a dick. And look, y'all, the reality is a lot of the people we pick up are just fucking assholes.
Yeah.
Like there's no way around it. Like no matter how compassionate and caring I can be, people just are dicks sometimes.
Yeah, it's not a compassion fatigue that people will run into in this job. Mm-hmm. It's everyone's like, well, it's your most dire moment and you're calling 911. And you're like, it might be.
Maybe. For some people it is.
And for some people it is. And for that guy, it was up there. But maybe
the bullet ripping through his spinal cord.
That's why I said it's up there.
It's up there.
It's probably a second.
yeah, it's close.
It's got a bronze medal.
Yeah.
But you're a dick.
He was a huge dick.
Stop being a dick.
He was such a dick. I was doing clinical rotations on a med surg floor, and the nurses, I had to explain to them, like, I've been in this for a decade. I'm not one of these little babies walking around here. And I was telling the nurse this call. She said his name.
Yep.
She was like, oh, I know him. I've had him before. He's a fucking asshole.
He's a fucking asshole.
Yep. Correct. He is. He's a jerk.
Yes. Yeah, he's an absolute dick, I'm sure. But I think one of the weirdest ones, this is the James Woods call. James Woods is what I call this one.
Not actual James Woods?
No, but I dropped the joke, the Family Guy joke with it. So she was about 5 feet tall, and she was just like that 90s band. She was a perfect circle.
Oh.
So she was 550 pounds.
Waterbed patient?
Yep. Mm-hmm. And so she had called for something completely unrelated, like nauseous or something. I don't know, whatever.
Yeah.
And so we get there. The fire department's been on there before, and they're like, the only way to get this person out is she's too wide to fit through the doorway. Mm-hmm. So this was the only time I've ever had to is to double mega mover this person. So, yep. So,
I think I can already see where you're going with this.
Yep. So this is the James Woods part of it. We had to take 1 mega mover, and this is coming at the orders of the fire department and the lieutenant. Mm-hmm. This isn't shitty EMS being like, oh, we got to try something. They're like, this is the only way to get this person out this door. It's a 30-inch door and she's 48 inches wide. You have to smush her. Mm-hmm. And so took the mega mover, wrapped her up, and then they roped her and cinched it like ratchet straps.
Like tying up a ham.
Yes.
Oh.
It's just real tight.
Yeah.
tied it up to smush her this way, and then tied the Mega Mover. And so the Mega Mover basically was a full body compression just to get her out the door. Second Mega Mover, we laid on the ground because we had to literally pick up 550 fucking pounds and go gunk and drop her on the floor because it was too tight to even carry this person out. Like there wasn't enough people in moving space to do it. They're like, just drag her out.
Yeah. Oh yeah.
But before we're doing that, we're getting blankets and everything off. And I see this little right in her fucking crotch. There's one of the lowest moments in my life. I'm going to say this and
don't worry. Everyone already hates you.
Yeah, I know. I had gloves on just so we're clear, but, there was this little gold shimmer.
Oh,
right in the honey pot. And so of course I'm immediately intrigued to be like, what's down there?
Is that?
And so I fucking go in there and I pinch it and I grab it out, and it's a completely sealed but soft and melted because it's stuck between so much body heat. It was one of those little Hershey. It was like a little candy bar in a wrapper.
Nice.
Yeah, and I was like, "Ooh, a piece of candy."
Did you cut it with your snack shears, squirt it in your mouth real quick?
Oh, dude.
No.
I picked it up and everyone saw me do it. And I go, "Oh, a piece of candy." Dude. Everyone came to a grinding halt. They're like, 2 seconds. We have to go laugh real quick. And then came back, obviously, and finished doing this. So we tied her up. And while we're doing this, unrelated to whatever reason we came out for, we went to lift her arm up, right? And immediately it was like the most rotten egg smell.
Is it like the equivalent of the cartoon hobo smelling the pie and it like lifts them up, like float over to it?
Yep. Yeah. Dude, you could see it. You could see the stench coming off.
Yeah. Stink lines.
Yep. It was like, when you see like all that heat and it's kind of like hazy. Dude,
Yeah.
It
Yeah.
just had to be like that. But lifts her arm up and I see just like a little shade of darkness. And I'm like, hold on 1 second. And it's under the side boob, which is,
It's all side boob.
giant, right?
Yeah.
And so I push it up and it is as black as your shirt. It is black. And just as soon as I did it, pus immediately. And I was like, how long has that been going on? She's like, how long has what been going on? And I'm like, nothing.
Don't worry about it.
Dude. Yeah. That is a problem for you, and there's nothing for me to do. I had a towel and I went like this because I'm like, I'm not getting gangrene. Dude, it was that black, greeny, rotten. And, just packed it, flop that side boob right back over for direct pressure and continued to tacoed her up, strapped her down. And it was everyone's personal PR of like not a deadlift, but literally a drag and drop.
Yeah.
Where you just went, shook the whole mobile home. And then we just tacoed her out and just drug her out of the house.
Yeah.
But dude,
you got to do what you got to do.
Side boob gangrene. Yeah. She was just so unconcerned about it.
Were you with me when we were waiting in the hallway at the one downtown hospital? And the lady was sitting in the hall bed and she had gangrene and her entire arm was exposed down to the bone and her rib cage was exposed down to the bone. She had the lung hanging out the bottom underneath the rib cage. You weren't there. I thought you and I were together for it.
No.
Yeah, you know the hospital I'm talking about. So we go up there, we're waiting to drop off our patient, and I'm standing there, and there's this woman. She's probably like 70, 80, and she looks like a zombie from The Walking Dead. And I'm like, what the fuck is going on? So all her bicep and tricep are gone. She just got exposed humerus. You can see the humeral head and everything, and you can see all of her ribs and her intercostal tissue. And she has a chunk of lung, like baseball size, just out the bottom, underneath her rib, exposed. And when she took a breath, it just like pump up.
Dude,
And
that'd be awesome.
it's one of the most insane things I've ever seen, especially sitting in a hallway. And a nurse came by. I said the name.
Said the name. Whoops.
Whatever.
Whatever.
But I asked the nurse, I was like, what the fuck is going on with this lady? And she had necrotizing fasciitis, and she lost, she had all this, what do they call it? Debridement of the wound. And the doctors came by to assess it, and they just pulled the bandages off and were like, yeah, that looks terrible. And they just left her there. They didn't put a sheet over her or anything. Just kept going.
Dude, that place is like the most deli counter hospital.
Yeah.
Sitting there with it's so crazy. Like they don't actually triage the patients. It's a first come, first serve.
Yeah.
I'm sitting behind, 6, 7 transfers from tertiary facilities that are on their cell phone, and I've got to head through a windshield.
GSW to the chest.
Yeah.
Yeah.
Insane. They're like, oh, wait in line. I'm like, no.
Yep. No, dude, I have so many stories about that place.
Yeah.
They don't care. I think they do care. I just think they're so overwhelmed.
Yeah.
What are you going to do?
Yeah.
Yep.
They have 10 billion ER beds.
Yeah.
And
they only have 40. They only have 40 ER beds.
Yeah.
That's crazy.
Well, rooms.
Yeah, they have rooms.
Bunk beds in the hallways.
They do. And they have chairs in the closets.
Yeah.
The other day they had 80 something patients in the ER waiting for beds upstairs.
Dude.
That's crazy.
That's bananas.
That's twice as many beds as they have in the ER.
Jeez.
Just put them in wheelchairs and wait till a room opens up.
Yeah. Yeah, that's crazy. Yeah, diabetic foot ulcers are.
Yeah.
That's what you get a lot.
Yeah, a lot.
Yeah. People mismanaging it and just not caring. And
so one more for you. This gentleman had diabetic neuropathy, so he had no feeling in his feet. And he goes on a fun little kayak trip in the dead of summer with his family. And he goes out onto the concrete dock and he stands out there barefoot, waiting for his family for, 45 minutes, an hour. And his feet burn off.
Yeah.
And he goes and he gets his feet amputated because he has such severe burns on his feet. And they like Pac-Man sew the ends of his leg. So it's like, that. But he doesn't have any circulation, so it's not healing at all. And they call us because his wounds have opened. And we get there, and it's just like Pac-Man with his mouth open, just purulent, wide open, just both legs. Just rough.
Dude,
I've stepped on some hot docks before.
He did too.
He did. He stood there for a long time.
Yeah.
I think he kayaked as well that day. I mean, if you're going to burn your feet off, you might as well have fun on the water.
Hey, dude, yeah. It's the last time with your feet. Put them to use.
Yeah. Well, you don't use them that much in a kayak.
Still, walking. Mm-hmm. I mean, he can still walk now, but very piratey of him.
Bilateral peg legs.
Yar.
Yard, mate.
Yard. Yeah, he was just getting used to on the kayak. He's getting his pirate in.
Yeah.
It's got a little flag in the back and a little bird.
Next Halloween, I actually want to go as a pirate with a peg leg, a hook hand, and an eye patch, and just walk up to people. Probably do it at work because other people won't get it. Be like, "Yard matey, you know how I lost this leg?" Be like, "No, how?" And be like, "Yeah, diabetic neuropathy. You want to know how I lost this eye? Yarg is diabetic retinopathy."
Oh, dude. Jeez.
Are those in bad taste?
No.
Amy won't.
No one will laugh. They'll be like, "That's real sad." Like, I know, right?
Amy won't do the AccuCheck with me. That's the one I want to do, where I wear like a black jumpsuit and have like the little blood strip test
I see where this is
blood
going.
sugar test strip, and she's an AccuCheck machine.
Yep. Continue.
She's like, that's not funny or clever.
Yeah.
It's just crass. I was like, well, what if we swap it around and I'm the AccuCheck machine?
Oh, yeah. Do you just got a big AccuCheck strip right here?
Well, she'd have the big AccuCheck strip.
Yeah. Oh, I know.
Yeah.
Yeah.
Hi, Amy. She's going to roll her eyes so hard she's going to have a cord and dens fracture.
Jesus. But yeah, there's been some crazy diabetic fucking things.
Yeah.
People losing hands and
Diabetes
feet.
is a hell of a
Mostly
drug.
feet.
A lot of feet. Yeah.
Lots
a lot
of
of eyes.
feet.
A lot
Lots
of
of
CVAs.
Mm-hmm.
A lot of myocardial infarctions.
Mm-hmm.
Mm-hmm. A lot of obesity.
Yeah.
Got them obeses.
Yeah.
Yeah.
But dude, the gangrenes. It's just try to describe the smell.
All right. Try to describe the smell.
Here's my descriptive word.
All right.
Smells warm. Smells hot.
That's a good
It's
description.
the only way I can describe
It does.
It's like hot and rotten.
The weird part is I wouldn't even go as far as saying that it smells like offensive. Like, I don't think that's the right way to describe it because it's kind of like where you smell a hot dumpster and you're like, that really stinks, but it's just so like the undertones of the stink are so complex that it's almost intriguing. And then you can never forget that smell again.
Yeah.
Oh, it's the smell equivalent of a terrible car crash. Like you can't look away from it. You can't smell away from it. Like you smell it and you're like, that's bad.
It smells hot. That's
Yeah.
the only way I can.
Yeah.
Like it's a thick, hot, like someone goes, but
Yeah.
it's just rotten.
Like really hot dog breath, but worse. Like if your dog was dead. Like if your dog just ate a rotting corpse and then breathed right in your nose
and then went,
right on you.
That's exactly what it's like.
You know, it's a smell I don't think you can describe. You have to smell it.
Mm-hmm.
Go to a local hospital, walk into the ER and say, I want to smell a diabetic foot ulcer.
Yeah, a gangrenous ulcer.
They'll let you right back.
Dude, they'll be like, you're a fucking psycho.
Yeah. Come on back. Sniff it.
Ugh.
No.
Dude, you'll never forget it. It'll live inside of you.
Yeah. Yeah, it's definitely one that you smell and it brings up memories. You know when you smell perfume?
How do you treat gangrene?
How do I treat gangrene or how is gangrene treated?
Mm-hmm. I mean, I know, but like we can just
I cover it up.
Yeah,
And
you
I
just
turn
wrap it up.
I turn the vent fans on and I sit in the captain's chair and I go, your vital signs look great. And then I write my report. And when I get to the hospital, I'm like, yeah, this is your problem now.
Yeah, this is an issue for a doctor.
But how the doctors take care of it is they go in and they do what's called debridement, which is just surgically cutting the rotten stuff off.
Mm-hmm.
And then you know what happens after that? It rots again.
It just keeps rotting.
Yeah, it just rots forever until you rot away.
Yep.
Or as our good doctor friend would say, you just dissolve.
You just dissolve.
One day you just dissolve.
Maybe.
Probably not.
Probably not.
He was like 18 years in, hadn't dissolved.
Nope. Yeah. Yeah. That's so gross.
Yeah.
There's no way. The thing is there's no real way to describe it to be like a crazy, like, oh, that's a crazy story. Because you really have to see it.
Yeah, you got to be there.
Yeah.
Yeah.
Of which in this episode, I'm probably going to find when we put it up. We'll probably put up pictures with it while we're talking.
Ooh, Fournier's disease?
Yeah.
Or Fournier's? I'll send it to you. So you.
Yeah, whatever it is.
Yeah.
Yeah,
that
shit's gross.
I didn't know how to spell it and I couldn't remember what it was. So I just looked up,
Butt gangrene.
I looked up gangrene of the groin and it came up right away. It's like, I got you.
I know what you're looking for.
Yeah.
Gross.
It's weird. The first link was an OnlyFans.
Yeah, dude. Yeah. Trying to get some money on the way out.
Yeah, I might as well. If someone. Oh,
Imagine sucking on a diabetic toe.
how much?
Dude.
How much?
There isn't a dollar amount. There really isn't.
What would it take?
You would get gangrene in your fucking mouth.
Maybe.
Well, I mean,
you have good circulation in your mouth.
dude.
Don't worry. The taste of your vomit will cover up the taste of the foot.
Dude, if there's no way. There isn't a dollar amount.
Yeah.
I mean,
I don't think. I don't know if there's enough money.
I would do it with full anticipation of whatever money came through is going to go to my kids because I'm going to die.
I was thinking, how much of it am I going to spend on therapy?
Dude, I would spend that money so fast before I die, though.
Yeah.
It would have to be an Elon Musk amount of money.
Dude, I don't know if it's worth it. I'm going to die from old age before I can get over what I did. There's not enough money.
Every time you spend money, you're going to know, be like, oh,
Every
I
dollar.
made this money sucking on a gangrenous foot.
It would, how much money would it take for you to give a dead skunk a rim job? That's kind of
That's
the
it.
equivalent.
Yeah, roadkill. Like a rotting roadkill.
Yeah.
Gross. It's fucking disgusting.
Yeah, you're disgusting.
All right.
I'm disgusting.
Yeah.
Together, we are disgusting.
We are team disgusting. Yeah. I think that'll be it.
You think that's it?
I think the next episode, when we come back and record again, we'll do the why does every EMS and first responder fuck each other on shift?
It's because we all have you know what? I'll save that. I'll save it.
Save it.
I have the answer. But that's for another day.
That is for another day. It's because everyone's a degenerate.
An actual another day instead of us sitting here for 5 hours talking about things that we can't post on the internet.
Correct. So, all right. Well, that's it.
Right.
Signing off. Thank you guys.
Yeah.
Also on socials, you can submit your dumb stories or funny stories, not sad stories.
Yeah. I mean, you can submit the sad stories, but we're just going to read them and be like, that's sad.
That's super sad.
That's so sad.
Yeah. Tell us your fun stories. We'd love to hear them.
Yeah. We'll do some more gruesome stuff in the future.
Yeah.
Those are going to be special episodes.
Yeah. This is just the warm up.
Yeah. Just got to warm it up.
Warming up a little bit. Because we went full tilt too fast.
It's straight into it.
Right in.
Yeah.
So, all right. Well, and supposedly we're going to be having some other first responders on.
I would love to have a guest on.
Oh, yeah. We're having guests.
I feel like our banter is better when we have a guest.
Correct. Well, yeah. Well, they're also sitting there with their jaw like, what the fuck?
Oh, we got to get Cher on.
Yeah. Dude, we have the physicians that wanted to come on.
I talked.
Did you really?
Yeah. He doesn't seem like he's game. Maybe. Maybe.
I want Doc
Or two. That'd be awesome.
super smart.
Yep.
Problem is he'll ask me what to do and I'll be like, I don't know.
Like what to do to talk about?
Yeah. Like, how do you treat it? I was your medical director. Like, oh, I don't know.
Actually, I think that'd be pretty funny for him to just make fun of us the entire time.
Yeah. He's like, you guys are fucking stupid.
Correct.
That's why I quit.
Yeah. Yeah. Oh, yeah. Oh, you weren't there. I had a fun conversation with one of the physicians.
Oh, God.
And I got to ask him if he became our medical director.
Correct.
And I asked if he had to go on a 72-hour hold after he agreed to that.
Yeah.
He said no. He's just straight faced. That was it. He just,
No.
That's
about right.
And then he said, but I might have to if today continues the way it does. And I was like, oh, there you are. There's
There
your
it
sick,
is.
depraved little brain. I knew it was in
Jesus.
there. I'm going to tell him to watch this. What's up?
Ugh. He's going to be like, I am going to QA every single one of your fucking reports.
I hope he does.
Dude, shit. We'll leave little happy messages in random places.
Yeah. On my annual review, I wrote again.
Jesus.
Yeah.
Anyways, all right.
Last time he sent me a letter back.
Yeah.
He said, hi, how are you doing?
Oh, jeez.
He's cool.
He's like, please stop.
Yeah.
Well, yeah. So that'll be it for today. We'll gonna get a strong game plan of the next couple episodes.
Yeah.
I'm gonna try to get this out this week.
Oh, that would be cool.
Yeah.
We can share it around.
Yeah. It'll be fun. I think it'll be fun.
I don't know.
Yeah. So
I don't know. I know the city is hiring.
Mm-hmm.
You know what? There are so many good jobs we could go to.
Yeah. OnlyFans.
OnlyFans.
Not me, but
I'll do OnlyFans.
yeah. Yeah. If you guys don't like and subscribe this shit, we're gonna have to. So
No, don't say that. Then they won't
Please.
intentionally. But like, I want to see what that's all
let's
about.
see your fat fucking face do OnlyFans.
Oh, I wasn't sure where that was going. I didn't think you were going to say face.
Oh well, that's
They were going to say feet.
yes, that too.
Yeah, only feet.
Sausage toes.
Yeah. No, I got them long fingy toes.
Yeah, no.
I'm not going to show them.
Gross.
They don't get to see them.
All right, well, that's it. Love you guys. Goodbye.
Oh, I love you too. Bye. Wait, do I love you or them?
Not them, probably.
Oh, bye.
Bye.